the pandemic is going to go in 2 weeks from now. So using information coming from people, from their answers to the triage questions, but also from geolocation, car movements, etc., where people are moving from one location to another one. But still, we need people to answer questions. And this is where it eventually succeeds and fails. If they do not answer, we don't have any indication. And this one is very hard. So one of the things that we started changing in the beginning, people were volunteering. 25% of the population of Israel was filling in the questionnaire at least once a week, with 83 to 89% completion rates, depending on the different weeks. But then the first wave was over. The population said that we don't need to answer more clinical triage questions. We're all healthy. And this is how we started the second wave here in Israel as well. So we had amazing 2 months between the first and the second wave. No sick people, less than 12 people sick every day. And today we're reaching to even 2,000 on a daily basis. So the idea was, how do you make people actually volunteer and answer this data? So a lot of the changes that we started to do is to make it obligatory. If you want to have access to anything in the healthcare system, in certain countries, you cannot even receive money from the social system without filling in the clinical triage questionnaire. And the idea is we need to really quickly capture this. Israel had 2 ways of trying to handle the pandemic. The first one was based on location. If you're very close to a sick person, you get a text message and you would be sent to sit at home for a couple of weeks. Problem is, a lot of people are complaining about the privacy. They stopped it. Now they started it again. The second one is clinical, like I just suggested. So the entire clinical triage, identification of areas, and what Israel is now doing, they're marking areas in green, yellow, and red based on the feeds of information coming from our system, from the COVID test results and other information. And the green ones will not have any lockdowns. The red ones will have much more restrictions. And this is why people have more incentives to both answer those things and actually keep social distancing.